this is how we're doing it in BC. That when we use non-traditional suppliers, we extensively test those new supplies. Now, of course, once they've been approved and they've gone through the process, we can have confidence in them. But to do that, to have people in our system use PPE, requires it to meet the test for British Columbia. And that's why we've been systematic. We've reached out and acquired a very significant amount of PPE from N95 respirators or equivalent to others. And then we've systematically gone through working with our employees, testing the product to make sure it meets our standard. And we should do that, surely, before we have anyone wear it. So I think it is a good day that the PPE, especially in one area, the respirators that we've acquired, have met that test and indeed exceeded the standard. I think that's good news, and that's the report we're doing. And what we've said on PPE from the beginning was that we report on the challenges. We report week to week on where we stood, on what we'd acquired and what we hadn't acquired, what the federal government had acquired in their efforts to assist provincial governments with PPE, and I think we did that today. And I think it is very good news, because what it says is that all of the people working together in the healthcare system in the most difficult of times have come through this and are coming through this, and we're now having a very significant new supply of some PPE coming in the market that people can have confidence in because it's been tested and we're going to work with people on. And that's how you prepare, not just for now but for the future in terms of PPE, because we don't know how long the global supply chains are going to be interrupted. So we have to go out and can't depend on anyone else, can't depend on the federal government, can't depend on our traditional suppliers. We've had to depend on ourselves, and I'm very proud of the people who've worked on it. And what you're seeing, what you're talking about in terms of celebration, is a systematic, serious, scientific approach to a significant problem that beset every health system in the world. And I'm really proud of our team. And the other part that was critical about PPE was the inclusion in our supply chain early. And this was part of the Team BC approach we took to long-term care that included providers who, public beds and private facilities, and included health authority owned and operated beds where we included long-term care homes. We didn't in our supply chain. I think that made a lot of sense, and I think that gave great support to long-term care homes, and that was a decision that other jurisdictions made, but they made later. And I think our approach to PPE, driven by unbelievable dedication from public servants and from health authority officials, has been a good approach. So today is a good day, but this is a problem we're going to have to work on every day going forward in a global market for PPE that has been so fundamentally disrupted. We've got to continue to do our work, and as you would know as well, we have to continue nationally to increase domestic manufacturing PPE so that our long-term security is in a better position in the coming years.